Good evening. Mino Kijagad, which is Algonquin for it's a good day. And it is a good day. And je suis très heureuse d'être ici ce soir avec vous sur le territoire traditionnel des Algonquins. It is particularly exciting it's like that you've organized this amazing reunion of all these amazing people that have inspired me over the years, and particularly congratulations, Monica, and huge congratulations, Ryan, for your next chapter in real politics. I want to remind you that when I finally first got elected, somebody said at least it'll be easier than medical politics, and actually, when I got into medical school, my mother said it'd be easier than being a florist. So it keeps on. So to see Trevor and Dennis and Janet Hatcher Roberts and Corey and Jody, these are the days that I've always referred to as my brain spa, when I get to come and be inspired by wonderful people and experts that just continue to inspire us all and our country, and to actually be here with my hero Monique Bégin, who I lovingly refer to as the sort of wise women that have always inspired me. And I used to tell people, young people coming, that you've got to have a posse. You don't do anything on your own, and that to have a posse of people who tell you when you're doing a good job and tell you when you're not is always, just saves time somehow. If somebody will just tell you there's a course correction required now, and to have Dr. Wilkinson here, who that book that Dennis reminded us of, Unhealthy Societies, The Afflictions of Inequality, was a year before I got elected, but again fed into the work that we'd been trying to do at Women's College, where we were dealing with violence and the environment and so many other issues around poverty and inequality. So it's what I laughed when I saw what the words that were put on the page for me, where it said, closing the health gaps between people in this country is one of the most urgent issues of our time. I then went to my desk beside me, and there was this beautiful drum that I'd been given with the lovely turtle on the back, and it was called First Nations Health Close the Gap. And I think that was 15 years ago or so, the AFN Health Conference on Closing Gaps. So I think that we should get on with this, as Natan's slide said, and somehow calling it urgent doesn't seem to work. So I just think that let's just get on with it. It was, I think, during the Romano hearings, where after we saw the first report, we were a bit worried that it was very much on health care and not on the health of Canadians. And I think that we then began working on, and it was Harvey Skinner, I think, who started explaining that everywhere I go, I get to explain to people the difference between health and health care, that you cannot use the words interchangeably, because actually we want more health, and what we would like for ourselves and our families is to not, or to need less health care. We'd rather not go to the hospital. And so I think that's one of the challenges. So both as a family doc and an MP and Minister of State, and during that Romano process, I was a bit concerned that people didn't know what upstream meant, in that not everybody knew the story of the babies in the river and taking them out and then finding who's throwing them in at the top. So we started with a quiz. It was called Are You Ready for Romano? And so I'll just give you a couple of the quizzes. One was, would you rather have a strong fence at the top of the cliff or the state-of-the-art paramedics and ambulances at the bottom? Then the next quiz was, would you rather have clean air or enough puffers and respirators for everybody? And so I have to say that I still consider myself the Minister of Social Determinants of Health. And I just wanted to share a tiny bit about my little journey from that time when I, not only as a family doctor and as an MP, but certainly as the Minister of State for Public Health, where I began this journey of actually new friends who were First Nations, Inuit, and Métis, new friends who taught me what it really meant to think 7 generations out, what it really meant in terms of focus on the medicine wheel instead of the medical model, what that really meant in terms of Indigenous pedagogy of learning by doing, or putting children first in all policies, or listening to wise women. Elders instead of elderly. I'm looking forward to that change. And of course, the one that is about leadership. It is about asking, not telling. It is about finding out, as Max Fine-Day said today, are the solutions already there? That we keep drumming about the problems when the solutions exist if only we would ask and we would listen. And this was always my explanation during campaigns and elections, that my job is the same as a family doc and as an MP. I ask what's wrong, I listen, together we make a plan. And that this is actually how we get to go forward. And it won't be as only public health professionals. I can remember after SARS in a room about this many people thinking, where are all the teachers? Where are all the people that we need to actually understand that we need to focus on health, not just health care, and that we are having quite a job at this as we actually understand that sometimes when we talk about social determinants of health, the whole room glazes over. But what are we going to do when it's just about fighting for a new drug on a formulary instead of actually focusing on whether it's prevention instead of corrections, or with all of the things that we know are going to be about the health, education, and economic outcomes of our country. It's interesting, last month when I was signing a memorandum of understanding with Doug Kelly from the First Nations Health Council in BC, that we just laughed about how long the two of us have been conspiring on social determinants of health. But we finally got to sign a memorandum of understanding on social determinants of health, meaning that even the First Nations Health Authority in BC is now understanding they've got to be much broader in their understanding of health rather than just health care. And so it's, I think that as I see Monique and think of the amazing work that she did with Sir Michael Marmot on the WHO Commission on Social Determinants of Health, how I, at that time, I think was viewed as some sort of groupie. It showed up every time they were speaking. But again, it was Sir Michael's understanding of the causes and the causes of the causes. And as I was saying at dinner, that when I first became an MP and then later as Minister of Public Health, there was this ongoing war, it seemed, between the Choose Health people, which was if these people would just stop smoking, exercise, and eat nicely, everything would be fine. And the Dennis Raphael, who never shut up about it's poverty, stupid, right? And so these people didn't like each other very much. And it was, again, the difference between respectful relationships and putting on a condom. It just didn't seem to... Like, you don't have to have sex with somebody you don't like. And so how do we deal with this in a way that actually helps? So that was one day when I wrote on a boarding pass, well, what if the social determinants were the roots and the choices were the trunk, and the outcomes were up in the branches? And then the medical officers of health decided that they didn't want my happy little apple tree to have its leaves fall off every fall. So we moved to a beautiful Georgian Bay pine tree. The west wind shapes the pine. So I could eliminate all the branches for everything we didn't want. So we didn't want kidney disease or preventable injury or diabetes or respiratory disease, and we put all the nice outcomes out this side, including Nobel Prizes and Olympic medals. And we thought we were doing very well on this model until Bill Mussel from the Native Mental Health Association said your tree needs ground, Carolyn. It's sort of nowhere. And so we drew in the ground, and he said the ground is the secure personal cultural identity. It's people's resilience. It's whether they feel good about themselves, and particularly whether you end up with proud Indigenous people who actually will make healthy choices, and that is the way forward. And it's really interesting. Quand quelqu'un a une identité personnelle et culturelle solide, ceci mène à bonne santé, un meilleur niveau d'éducation et des résultats économiques à long terme. It's what Max Fine Day and Natan was saying. This is everywhere I go, whether it's the Inuit youth or the Attawapiskat youth or the Whitehorse youth, that they want a secure personal cultural identity. They want their language. They want to be competent on the land and the water. And they don't want, as we learn in Toronto, nature deficit disorder. It's ridiculous. This is so straightforward, but it's always been viewed as some fluffy extra if we can afford language and culture, if we can afford, and this is intimately related to the statistics we've all heard, suicide, TB, diabetes, that we actually know that in closing the gap, we have to go upstream, which is why you're all here. So it is about not building a better repair shop. And when we were doing the health goals process that Janet Hatcher-Roberts facilitated in 2005, only half of 9 of the goals were about the healthcare system. Everything else was about sense of belonging, about clean air, clean water, that it was about the way that we would go forward in basic needs, belonging, engagement, healthy living, and systems for health, which is what the Ottawa Charter said. It's moved from a health care system to systems for health. And that means that we have to move across all government departments in all jurisdictions. We are in gridlock because of the silos and the horizontal nature. So Dr. Marcoux didn't say, on his slides there were some interesting things that he didn't have time to, but the advocacy for the child welfare system is something that we as family doctors did all the time. And now Dr. Evan Adams has a very good reason why. Kids apprehended at birth live 20 years less. We can't just sit back and have these kids taken away from their language and culture. We know better. And that's why we're fighting to the fundamental overhaul of this system, and including what we heard. Poverty does not equal neglect, but there can be neglect without poverty. We actually have to make sure we're not discriminating in these assumptions that are all over the place. Like some grandparent who had a criminal record 30 years ago. Really? If that's the right person to look after these kids for a while, then that's the right place, and that's where we have to go. We learned a lot in the gatherings around missing and murdered Indigenous women and girls. We learned that almost every one of the families had had some attachment to the child welfare system. There had been abuse in most of the victims and most of the perpetrators. That this is what happens when you suffer abuse. And so we now are understanding the TRC motto, which was for the child that's taken, but for the parent left behind. When those moms had their kid taken from them, they descended into all from overdose to suicide to risky behaviors that ended up with their murder. So that's why we are hoping with the commission that we're going to get finally to the bottom, the root causes of underlying systemic causes of violence. It means that for the first time that the provinces and territories have been involved in the terms of reference and the approving of the commission, because it means we're going to have to deal with child welfare systems, with sexism and racism in policing. We have to get on with this, and that's why, as we hear of trauma informed, why this is so important that the commission work that way. The chief commissioner in her court is always asking the question, I understand you were harmed as a child. What can we do to help you get on a good path? Do you have a family doctor? You're going to need one. Can you come back next week with 5 words in your own language? This is the kinds of things that we know and that we can just get on with. But we can't wait for the results of the commission, and that's why we are pretty excited that we can now really begin to build on the housing, education, shelters, culture, but also healing. And, you know, when I was asked to speak at the board of the Governing Council of the CIHR, I took them all a copy of Indigenous Healing by Rupert Ross about his journey through as the prosecutor in Kenora, a lawyer. That what learning about Indigenous culture meant to his success in him being able to turn these lives around one after one. Inside Indigenous healing, the inside is a quote from the Hollow Water study from 2001 or 2. It says that Indigenous healing is actually decolonization. And that's what you heard from Max this morning, that we actually have to change the way we do things, not only what we do, but how we do it. And it's the reason why that as we've invested and put the money there, that we actually now have to change the relationship with Indigenous peoples, with First Nations, Inuit, and Métis. In every mandate letter of every minister, it says that we will change the relationship, the most important one, to Canada, based on a recognition of rights, respect, cooperation, and partnership. That means that's a very different thing. And I guess I'm just here tonight to say turning around the steamship of a very patriarchal, paternalistic, colonizing approach is going to be hard. But it's going to be worth it as we realize, and as was said to me or by one of my friends who works in North Winnipeg, that a young person put up their hand and said, how come poor people have programs and middle class, upper middle class people have institutions? And that's what we have to do. We have to turn this around from, I shouldn't be funding programs anymore. We need to be building Indigenous-led institutions where they take the decisions on, and that if Natan thinks that and believes in his heart and has evidence that having kids stop learning Inuktitut at grade 4, then they have to make those priority decisions. And that's one of the tough things that we are really convinced is the only way forward. So I often quote Gord Downey in my job in Canada at 150, in that it's not an easy celebration for Indigenous people in this country. But as Max said this morning, or this afternoon, that we've got 150 years behind us to learn from, and 150 years ahead of us, and we better just get to work. And that means going forward in a good way. But I think that in this group, we also know we've got 150 years behind us to get out from the medical model and into the medicine wheel. We've got to find the balance mentally, physically, emotionally, and spiritually. We've got to actually say that Canada led on this in terms of what, from the Lalonde report in 1974 on new perspectives to Madame Bégin grilling Alan Rock after health was split from welfare, and she said, "How are you going to do that?" And it is about the leadership of asking, not telling. So I guess I just want to say that in closing that I did an interview for BBC Hard Talk, well named. They said, why would this be any different this time, Minister? Everybody said it's going to change it. It's all, what makes you think that this time it's going to be different? And I said, yesterday I paddled for 3 hours with these kids from one of the most troubled communities in Canada, in La Loche. And we paddled into Batoche, and we hit this huge rock. And then we got into water so shallow, we had to get out and walk our canoe through it. But the current was with us, and we got where we were going, and we're going to get it done. So thank you, Miigwech.